Firecracker-induced eye injury. Diwali is a festival of light, and lighting fireworks is an important part of the celebration. Unfortunately, during Diwali, the risk of firecracker injury increases significantly in India. Children and young adults are at risk for irreversible blindness and ocular morbidity due to ocular trauma. Fireworks injuries account for 20% of all ocular trauma. Eye injuries due to firecrackers. Eyelid laceration. Eyelid lacerations are defects in the eyelid that can be either partial or full thickness. They may also be accompanied by other ocular injuries such as corneal abrasions, disruptions of the surrounding structures, foreign bodies, penetrating eye injury, or orbital fractures. Conjunctival and corneal injuries. Ocular burns, corneal abrasions, and conjunctival and corneal foreign bodies are some examples of such injuries. It might even require surgery if necessary. An eye wash is often necessary to remove small particles that can cause allergies and infections in the eye. Subconjunctival hemorrhage. The conjunctiva's blood vessels may burst as a result of trauma, which will result in blood accumulating there. Traumatic iritis. The iris is a muscle in the eye that contracts and expands in response to certain stimuli such as light, causing the pupil to change size. In cases of trauma, this vascular iris becomes irritated, which triggers the production of inflammatory cells. This causes pain, photophobia, and decreased vision. Hyphema. A hyphema is a buildup of blood in the eye's anterior chamber. Blood can build up as a result of trauma to the ciliary body or iris blood vessels. The likelihood of developing secondary glaucoma increases with the degree of hyphema because the red blood cells clog the draining angle. Retrobulbar hemorrhage. Firecracker injury may cause bleeding from the intraorbital artery, resulting in retrobulbar hemorrhage. As a result of the blood accumulation posteriorly, the eye may end up protruding out. A surgical procedure called lateral canthotomy that involves cutting the lateral angle of the eye might be necessary to depressurize the orbit. Vitreous hemorrhage, VH. VH occurs when blood extravasates into the vitreous, a gel-like substance that fills the back of the eye. This can occur as a result of blunt trauma or penetrating trauma. Retinal detachment. Like VH, there are two types of traumatic retinal detachments: those caused by a blunt contusion and those caused by a perforation of the eye's posterior segment. It is possible for retinal breaks to develop months or years after the trauma occurs. Performing repeated fundus examinations will help identify retinal breaks before retinal detachment occurs. Angle recession glaucoma. Angle recession glaucoma is caused by non-penetrating or contusive ocular trauma. A receding anterior chamber, visible on gonioscopy, affects fluid drainage, which increases IOP. A small portion of those affected goes on to experience vision loss and glaucomatous optic neuropathy days, months, or even years later. Tips for prevention. Wearing protective eye goggles when bursting crackers. Always have an adult watch over kids using firecrackers. Keep a safe distance when bursting crackers. Don't try to restart a firework that didn't go off. Wait at least a few minutes before approaching it. Never light a firework while holding it in your hands or pointing it at someone. Firecrackers should only be lit outside in an open area. Use only firecrackers purchased from authorized retailers and brands. Keep a fire extinguisher nearby at all times, or the very least, a bucket of water and sand to put out any stray flames. The fireworks should be ignited using long sticks instead of small matchsticks. Do not touch or rub your eyes if you have been hurt. Wash your eyes with clean water. Find a doctor right away and avoid attempting to treat any injuries yourself. Have fun and stay safe.